If you've been told that type 2 diabetes is something you'll have to manage for the rest of your life, you're being fooled. Most diabetes treatments are designed to control symptoms instead of fixing the root problem, and today I'm going to explain the difference. Let's start with this. Most treatments for type 2 diabetes are focused on one thing alone, which is lowering blood sugar. Taking medications, taking insulin, even dietary changes are aimed at keeping your numbers in range. And yes, keeping blood sugar stable matters. But here's the problem. Lowering blood sugar is not the same as fixing why it's high in the first place. Because you can take medication, see better numbers, and still have the underlying issue getting worse. That's why many people feel like they're in a cycle. They start with one medication, then another gets added, then doses increase, and eventually it leads to insulin. So even though the numbers are being managed, the condition itself is still progressing. And this is where the mistake happens. Type 2 diabetes is not just a blood sugar issue, it's an insulin resistance problem, a metabolic dysfunction, a signaling problem inside your body. So if the treatment only focuses on blood sugar, but ignores what's causing the insulin resistance, you're managing the symptoms and not resolving the cause. That's why so many people feel stuck. They're doing exactly what they have been told, but they're not actually getting better. If this is already making sense and you want more content like this, make sure you're subscribed. I break this down every single week. Now, why is this happening to you and what most standard approaches are missing? You see, medications lower blood sugar, but don't fix insulin resistance. Insulin therapy can sometimes increase insulin levels further. Root drivers like inflammation and metabolic dysfunction are driving the cellular damage at the level where your body needs to be optimized. And if the cells are not doing their jobs effectively, that is where the major issue is coming from. But again, in most cases, all of it is being addressed at the sugar level. So if we don't actually go to the root cause where the cellular damage is, we'll never get to the root issues and you'll continue to progress with your diabetic condition. And as the root drivers like inflammation and metabolic dysfunction are addressed, standard care focuses on management, not reversal. At this point, you might be thinking, okay, medications lower blood sugar, but don't fix insulin resistance. Insulin therapy can sometimes increase insulin levels further. Root drivers like inflammation and metabolic dysfunction aren't addressed. Standard care focuses on management and not reversal. Using medications like insulin will essentially just force the sugars into your cells. It's not really doing anything to actually fix the cell that's damaged in the first place. Underlying causes will be things like inflammation and metabolic dysfunction. Inflammation is like fire. So what is that going to do to your cells? It's going to destroy, it's going to break them down, reducing the ability for the cell to do its job. And unfortunately, in a standard of care, they don't focus on reversing and getting to the root issue. They focus on management. At this point, you might be thinking, okay, so what should I actually be looking for and tested for? And this is exactly where most people get stuck. They're given treatment, but they're never shown how to identify what's actually driving their condition. So I put together a simple guide that walks you through the exact labs and markers to understand what's really going on beneath the surface. You can download it for free using the link below this video. My goal is simply to help you understand what's actually going on inside your body, and you'll see which markers really matter and why normal labs don't always tell the full story. Once you start looking at the root causes instead of just the symptoms, everything begins to shift. We start to see blood sugar improving without constantly chasing it. We start to see your insulin levels start to come down to normal levels as well. And we start to see that insulin sensitivity becoming more efficient. The ability to take that sugar and put it back into your cells where it belongs instead of sitting in your bloodstream, causing devastation and destruction at the cellular level and circulation level. And why many individuals continue to start reducing medication, obviously with the help of their medical doctor, because their condition is getting better. If your cells can start consuming the sugar as they should, what happens to the amount of sugar in your bloodstream? It goes down. So the need for medication over time starts to reduce, and this is what full reversal actually looks like. And you get to a point where the condition no longer feels progressive any longer, where you're starting to reverse the effects of things and no longer afraid of what the future actually holds. This is the difference between managing a condition and actually working towards reversing it. When you address what's causing the insulin resistance, your body can begin to regulate blood sugar the way it was designed to. That's when things start moving in the right direction, not just in your test results, but in how you actually feel. If this helped you understand your diabetes differently, download the guide below and start there. And if you want more clear, practical explanations like this, make sure you're subscribed. I post videos like this every single week.